Let us look at some histology spotters. So you will have to look at the slide and guess the from where the tissue is. Okay, so that is histology. It's the microscopy. And histology usually is the anatomy. That means it is normal. We are not showing you any abnormality here. Okay, so what do you think this is? This is the adrenal gland. Okay, we'll kind of go alphabetical. So let me tell you, this is also from A, and you can see a lot of fat here. This is adipose tissue. May not be the best slide though for adipose tissue. Okay, what do you think this is? You can see some lymph structures here. Yeah, this is appendix. You can see here it's not stained, so it is some unstained slide. So you can see it is longitudinal kind of a thing. You can see Haversian system. This is bone, longitudinal section. Okay, next. Obviously we are going alphabetical, so this is B again. So what is this? Bone transverse section. You can see osteons, right, with the Haversian canal in the center. So this is bone transverse section. Same thing they have shown here, bone transverse section. So this is a muscle. Can you guess? Considering that you see a branching here, right? So if there's branching and intercalated discs, what muscle is it? Cardiac muscle. Okay. So we'll give you a clue. This is C again. We are going alphabetically. So what is this one? This is cerebellum. Okay. Cerebellum. Okay. Here's another slide of cerebellum. You can see how patterned and purpley and pink it is, right? Cerebellum. What is this? Again from C. So this is cerebrum. Okay. Cerebrum. If you need to know why it is that, then you'll have to look at the details about the cells, the type of cells, pyramidal, granular, etc. Another cerebrum slide here. Guess this one. Pretty easy. Yes, it is cornea. This one, another one, cornea. So here you have the epithelium, right? Then you have the Bowman's membrane, right, which is nothing but the basement membrane. Then you have the substantia propria or the stroma. Then you have the Duas layer, then the Descemet's membrane. Then you have the endothelium, right? So the layers of cornea. So from here, light will fall, right? So what you have here? Epithelium, right? Cornea. What do you think this is? This is duodenum. Okay, this is duodenum. So we are going alphabetically, so you can definitely guess this is duodenum. What is this? It's labeled as something starting with E. It's elastic cartilage. So remember here you don't have cell nests and all that, and there'll be fibers, right, in the matrix. So elastic cartilage. Okay. Let's move on. See, basically in hyaline cartilage you'll have cell nests, right? That is not there here. What is this? I'll give you a clue. It is E, starting with E. Epididymis. Very good. Now again they have put the name here already. So this is esophagus. This is also esophagus. You can see some mucus acini, right? Esophagus, no doubt. So this is how we have drawn esophagus. Non-keratinized, stratified squamous epithelium, lamina propria, muscularis mucosa, esophageal glands, mucous glands. Then you have inner circular smooth muscle, outer longitudinal smooth muscle. Okay, so you have mucosa, submucosa, muscularis externa, adventitia. Can you guess this one? Starts with F. Very good. Fallopian tube. What do you think this is? Starts with G. Take a guess. It is gallbladder. Okay. Gallbladder. This one is also gallbladder. Now it begins with H. So can you say this one? Hyaline cartilage. Very good. Cartilage. You can see cell nests, and around the cell nest you can see territorial matrix, and then you can see interstitial matrix all around here. On top here you can see chondroblasts, and then you have the perichondrium, right? After H, what will you get? I. This is ileum. Okay? Ileum. This is also ileum. Next, jejunum. IJ. So you could have guessed J. Jejunum. Very good. Another jejunum here. Guess this one. Very easy. Just focus here. You have glomerulus. Glomerulus. Can you see? Glomerulus. So many of them. So this is, look at the glomerulus. You can see. Very nice image. This is kidney. Very good. Another kidney one here for you. Now this one is large artery, because you see the lumen is so small and this line looks so almost straight, right? So the lumen is very big. So it is a large artery. Okay. So you have what and all layers in artery? So tunica intima, tunica media, tunica adventitia. Here you have some vasa vasorum, that is blood supply for this itself. Then here you have the elastic fibers, smooth muscles, right? And you have the endothelium here, large artery. Example, aorta. This is labeled as large intestine. They are not differentiating, obviously. In small intestine, you had duodenum, ileum, jejunum. Here they have just put it as large intestine. This looks so pretty, isn't it? Just look at it. It looks so pretty. And these are all actually received in WhatsApp. So definitely the resolution would have reduced, isn't it? But still they look so beautiful. This is a vein, they are saying. How will you differentiate? Because it will not have that much of muscle. So the tunica media is minimal. Okay, and the lumen is collapsed here. This is also easy. You can see some circles here and there, and the pattern, hexagonal arrangement. Okay, so in the center, what do you have? Central vein, and all the hepatocytes are arranged. And then you have the hepatic sinusoids in the middle. Okay. So you'll have to draw what and all? In the corners, bile duct, hepatic artery, portal vein. That's the portal triad. Okay. How's it going, people? Take a break. We are looking at the slides for histology. Look at this one now. We'll give you a clue that it starts with L. Yeah, it's lung. Lung. What do you think this is? Definitely you can see so much purple here, and you can see something like circles here, right? Germinal centers. So this is lymph node. Okay, this is lymph node. Look at this one, lymph node. This is a beautiful one. You can see clear circles, right, inside the lymph node. This is an artery again. This is medium size because you can see a little more curvature here, right? So you can see it is a medium sized artery. What do you think this is? This is a gland. It's a mixed gland. It has serous and mucus acini. Okay. Mixed salivary gland. What do you think this is? You can see a lot of mucus here. So this is mucous gland. This one also mucous gland. So a lot of mucus you can see. So this is not mixed, right? Such a beautiful diagram, very unique, right? So pretty. What do you think this is? This is a nerve fiber transverse section. Okay. Transverse section of nerve fiber. It looks like a tree, right? Within this pink branches of a tree like. Nice it is. In 2 seconds you can identify this. What is this? Optic nerve. Very good. So you can see here this is the central artery, isn't it? Central artery of retina. Optic nerve. What do you think this is? You can see small, big circles here. So this is follicles which are primordial follicle, primary, secondary, tertiary follicle, Graafian follicle, corpus luteum. Yes, you got it. It's ovary. Very good. What do you think this is? It's not very clear, but you can see two different things here, right? We'll show you a better photo. Wait. So here you can see many types, right? So you have the posterior pituitary, pars intermedia, is it, in the middle, and then you have the anterior pituitary, right? It's also pituitary gland. Very unique, very beautiful, so many colors. So you have chromophobes, acidophils, basophils, right? How's it going so far with all the optic nerve and the brain, the pituitary? You saw the cerebrum, cerebellum. Shall we continue? We have now reached P. This one also is from P. Can you say? Can you see villi structure here? Pretty easy to recognize this one. It's placenta. Very good. Placenta. Okay. Another one of placenta. So here you can see some type of borders with things. What is this? Prostate gland. Okay. So this is prostate gland. So corpora amylacea is in the center. You have columnar epithelium, right? Fibromuscular stroma. Okay. So done with prostate gland. A lot of things from P have come, isn't it? Now look at this. It's not that difficult. Just think what it could be. See, layers are there here. And the rods, the cones. Yes, this is retina. So in retinitis pigmentosa or in any other condition, you should know a lot of things. How does retinal tear happen? What happens in diabetes, etc. Okay. So this is retina. Very important to know. So look at this retina. So from here light comes, let us say, through the vitreous humor. So you have the inner limiting membrane, nerve fiber layer, ganglionic layer, inner plexiform layer, inner nuclear layer, outer plexiform layer, outer nuclear layer, external limiting layer, layer of rods and cones, pigment cell layer. I told you about rods and cones, right? So that's you could have easily seen in that diagram. Okay. Moving on. Now what is this? This is a gland, but it is not mucous gland. So what is it? It's a serous gland. You can see pinpoint lumens, right? Serous gland. What do you think this is? Do you see any branching? This looks like branching to me, but it is not looks like because they have labeled it as skeletal muscle, okay? See, cardiac you can know. There should be branching, intercalated discs. Okay, focus people, what is this? This is spinal cord. Very good. You can clearly see the gray, white matter, etc. Right? Spinal cord. This is cervical, they are saying. This one is thoracic spinal cord, they are saying. This is spinal ganglion. The cells are all kind of together, right? And they are almost circular, is it? But in sympathetic, they'll be star-shaped. And these will have what? Central nucleus. And around it, they'll have cytoplasm. So this is spinal ganglion. Dorsal root ganglion, sensory ganglion. This is also the same thing, spinal ganglion. What do you think this is? You have the red and white or something, right? What is that? Spleen, correct. See how spleen should have red pulp, white pulp, right? Red pulp, white pulp. Another one of spleen here that you can see. Another one of spleen again. What do you think this one is? Stomach. How will you know stomach? Some gastric pits are there. They are saying mucosa, submucosa, muscularis externa, serosa, zymogen cells, oxyntic cells. Okay. At the pylorus, right? Stomach at pylorus, the gastric pits are deeper. And you can see there's more gap here or something they are showing. Okay. The pyloric glands are more grouped, they are saying. Basophilic cells, not zymogen. You have to read this much more in detail. So where were we here? This is stomach fundus. Then this is stomach pylorus. I would have said something else, but anyways, just focus here on these purple things here. Right? Going on. What do you think this is? The cells are here and there. The nucleus is a little eccentric if you look at it here. So this is sympathetic ganglion, not very clear. This one is very easy. Testis, very good. You can see the sperms, spermatids, right? Spermato, all those, right? Seminiferous tubules, correct? Cross section of seminiferous tubules. So you have Sertoli cells which are going to nurse the sperm, spermatogonia, primary spermatocyte, secondary spermatocyte, spermatid, spermatozoa. Done with testis. We are in T now, so let's finish off soon, don't worry. What do you think this is? Thick skin. See here, you can see those layers of skin, right, that you always learn. Stratum, corneum, lucidum, all that. Then, this is thin skin. I wouldn't believe if they hadn't labeled it. Okay, then, thin skin again. What is this? Lymphoid, yes, thymus. So this is, it is having those special hasals, some corpuscles, right? But same thymus, it doesn't look that purple here. But what and all, it will have capsule, cortex, medulla with that hasal corpuscles, right? Again, one more thymus here. Very easy, you can guess this one. There's a lot of colloid inside. Yes, thyroid. Pink, 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 pink secretions. Thyroid. Thyroid, full of colloid. Wow. Guess this one. It's pretty easy only. Tongue, very good. Tongue. Papillae. This is the circumvallate papillae of the tongue, right? That is why it is like that. Circumvallate papillae of the tongue. This is the fungiform papillae. What do you think this is? Some other lymph, so lymphy. This is tonsil. Very good. How would you recognize tonsil? There is some lumen here and there are some lymphoid follicles. Crypt is the main identification. Some notes has been made here. Do you see crypts in that one? Go there, please. Oh yeah, we do see crypts. Okay. Some main. Oh wow, such a beautiful crypt. Now it makes sense. If they give like this, then we will easily recognize, right? And now this is very, very interesting. See here you see hyaline cartilage. Here you see some mucus acini. And what do you think here? And then you see some kind of epithelium here. This is trachea. Very good. Very good. Very good. Excellent. What do you think this is? Looks like some ghost. If you're not able to see ghost. Yeah. Umbilical cord. Very good. There's only one vein and two arteries. Okay. Two arteries. One vein. Umbilical vein. It will take the oxygenated blood from placenta for the baby. Umbilical vein. Okay. You should check all this once the baby is born. What is this one? Look at this collapsed kind of a beautiful thing. This is ureter. Okay. Ureter. Ureter will go from where? From kidney to the urinary bladder. What is this one? This is urinary bladder itself. Main way you recognize this is the transitional epithelium. Okay. Umbrella shaped cells. I don't see any umbrella shaped cells. But anyways, this is urinary bladder. Moving on. This is uterus, proliferative uterus. How will you recognize this one? Glands. So you have the uterine glands. Okay. Spiral arteries. And here you have the secretory phase of the uterus. So what will you see here? Coiled uterine glands. So now you can see a wow moment here. This is uterus proliferative. Now this is uterus secretory. See how it is coiled glands, they said, right? Very nice. Next. This is vas deference. You can see the entire portion lumen you are able to see. Okay. Vas deference. This is white fibrocartilage, they are saying. See, we saw elastic cartilage, then we saw hyaline cartilage. Now this is white fibrocartilage. Okay. So we have finished 100 histology slides. All the best for your histology spotters. Bye bye.